Hey, we are talking about the overlap, the comorbid conditions of autism and functional neurologic disorders today. And I'm so excited you voted for this topic because this is something that we see a lot clinically. So thanks so much for joining me live or catching this recording. My name is Julie Hirschberg. I am a neurologic physical therapist and the owner and founder of Reactive Therapy and Wellness. I usually say we're in the Los Angeles area, but we are moving on Saturday, and it's still in the Los Angeles area, but we are moving to El Segundo, which is a lovely beachside town right by the airport, actually. So anyway, super excited about this move, but also very thankful. I read a ton of articles. I have two really lovely physical therapy friends that send me things all the time. And so I always have like a list of 40 things to read. And I put out a little poll at the beginning of the week, and you all said this topic. Now, I will say there were other topics people voted for. I am going to get to those and in the future, but this one won by kind of a landslide. This was a hot topic. So we're talking about autism and FND. And yeah, I was thinking this, somebody said right by a big ice rink too. Yes, our new location is right around the corner from the Toyota Center, which is a big ice rink and where a lot of people practice, if you're an ice skater, and where the Kings practice too. So I want to share the research article that I'm sharing. This is hot off the press, just published in 2025, and it's called Comorbidity Rates of Autism Spectrum Disorder and Functional Neurologic Disorder, a systematic review, meta-analysis of proportions and qualitative synthesis. And this is a big research group out of Australia, by the way, so out of Brisbane. So thank you to researchers who do this great work. So what did they do here? So when one does a systematic review, they're looking at all of the pieces of literature that have been published on this topic and seeing if they can actually pool the data from them. Now, I'm going to show you a couple of highlights here from this. So they had, what I love about a systematic review is that it goes and puts into tables what articles there were, right? So this table 1 goes through 14 different articles that they looked at and reviewed for the systematic review. So that's part of the process, right? So they're going to do a lit search with specific terms, look at all of the research, rank them with a scale. There's a scale out of 8 that looks at the quality of these, and then choose the ones that meet criteria to actually pool the results. So I show you this because this is table 1, and let me show you part 2 of table 1. So these are the 14 studies. So what I love about a systematic review is that this is a good way to kind of look at and synthesize a lot of the studies that have taken place on this topic. And I'm so glad there's 14 because I have to tell you, I guess, gosh, it was almost 2.5, 3 years ago when I went to the FND Society meeting. So I guess it was about 2022. And there were not a lot of studies. So a lot of these, if you look at this, are very new studies. And we were seeing this clinically. We were seeing these conditions coexist. We were kind of curious about why, and also curious if other people were seeing this or it was something that we were just seeing in our specialty practice. And I remember going to the FND Society, and there were a couple of posters. I think the group was from Spain, presenting their findings on the comorbid conditions of autism and FND. And I went up to that poster and was like, oh my gosh, yes, we are seeing this clinically. So this is kind of the impetus for this particular systematic review, because these authors too said, hey, these are co-occurring conditions. They're common conditions, and there are overlaps with them. So when we look at the introduction of this article, they really talk about that why, right? So they talk about the prevalence of autism and FND and how that there are some studies showing that they coexist, and particularly some of the why, right? And I am that just very curious neurophysical therapist. It's always like, okay, but why are these co-occurring, right? And they talk about in that introduction that some of those core features of functional neurologic disorders and autism, such as differences in interoception, the presence of alexithymia, which I just talked about last week, interoception and alexithymia, in my live video on interoception and FND, which is also what people voted for last week. So if you missed that one, go back and watch the recording. That was an article looking at interoceptive attention in functional neurologic disorders. But this is an overlap. Sensory processing is another overlap with autism and functional neurologic disorders. So it's not really surprising that we might find these coexisting. Now, here is where the research gets really challenging, is especially in functional neurologic disorders, but also in autism, it's a spectrum, right? It's called autism spectrum disorder. Now, I wish we'd just get rid of disorder out of the title, because I think in many neurodivergent conditions, thinking of it as disordered rather than just a difference could be really important. That's another time for another soapbox for me. But they both come with a lot of different presentations, right? So autism has a whole spectrum. Functional neurologic disorders do as well, with loads of different kinds of symptoms. So we might have functional seizures, we might have functional movement disorders or motor issues, functional sensory symptoms, functional cognitive symptoms, functional dizziness. So lots of subtypes. And this actually is part of what the authors of this study highlight as one of the challenges in pooling the data, because sometimes they don't talk about the subtypes, or sometimes they do, but it doesn't match other ones. And that makes it really hard to bring data together. So let's talk about what they did find. So I showed you those two tables. 14 studies met the criteria. And I'll just give you an example of the studies. I think they go back as early as 2016. And they would look at either a group of people with autism or a group of people with FND, and then oftentimes retrospectively look, do they also have, so like in a group of people with autism, do they also have functional symptoms or a diagnosis of functional neurologic disorder? Or vice versa, in a group of people with functional neurologic disorder, do they also have a diagnosis of autism, or do they meet the diagnostic criteria for autism through some of the screening tools that they might use with autism? Now, here's the thing. Of those 14 studies, they were all over the place. What screening tools they use, what how the person might have been diagnosed. And certainly it didn't take into consideration that some folks may have one or the other and not be diagnosed, right? So a lot of these would have missed folks, most likely. And what I liked about the table, so let me just show this table again, and I think it gives you a good idea of how to critically look at research as well. But if you look at the let's look at the last two columns. One is the N, like how many cases, right? And so you can see they're pretty small. There's 12. there's 8, there's 25, there's 26, there's 6, there's 79. That was a bigger study, right? There's 17, there's 13. So these are really small studies, which is why they would want to do a systematic review to see if they could pool all of this data together. In the last column, they also highlight some of the confounding factors or other comorbidities. So for a lot of the studies, they did not just focus on FND. They might be looking at also eating disorders, mood disorders, ADHD, PTSD, all kinds of other conditions, which is great actually, because they are likely looking, these studies are often looking at like what are some of the coexisting conditions and what are the prevalence, but hardly any of them were just looking at autism and FND. So this is really important. So they combed through these 14 studies and found 3. Let me show you those 3 right here. 3 that met the criteria that could, that they could be pooled together. And actually, once they further analyzed this data, they also found that one of the studies was an outlier and didn't really fit the criteria well either. But there's this study from McWilliams in 2019, Fox in 2022, and Friedman in 2023. And you can see these were larger studies with a total of 59, 112, or 191. And then the cases, right? So these are the cases of the overlap. And what they found as they pooled all of this data together, that the pooled prevalence of these conditions coexisting was 10%. And that is significant, right? It's significant to find this 10% comorbid condition. Now, some of the studies found more, some of them found less, and quite honestly, the data wasn't great, right? Because these were small studies to be looking at. They further looked at, so I'll stop sharing that one here. They further looked at the subtypes of FND. So functional seizures, functional motor disorders, functional cognitive disorders, and then mixed FND. Now, I gotta tell you, as a clinician, I frequently see mixed symptoms in folks. That's probably the most common. But in the studies, now, again, not all of these studies were in the pooled analysis because they did not have enough similarities. But one study specifically looked at functional seizures. This is the study by Cole and colleagues in 2023. And they found out of a group of 19 people with functional seizures, 31% scored positive on one of the autism screening scales. That's a higher amount, right, than what was found in the 10%. But that particular study really failed to meet the criteria to be part of the pooled analysis. But what is nice is that they actually did go through analyzing these other studies to give us some data on it. In functional movement disorders or motor disorders, they highlighted 2 studies, one in children by Martino and colleagues in 2023, and the other, the whole study as well. And they found that the presence of motor disorders or the presence of autism in functional motor disorders was 24% in children, and I think it was 37.8% in adults. So again, a very high comorbid condition, but those studies didn't meet the criteria to pool the results. So oftentimes when we think about this, we really need to think about subtypes, right? And that's, I think that's like a really important piece. Nobody has published on functional cognitive disorders, but in a study that looked at mixed groups, they found that they had a really large group of people with FND, and 8% of those people had a prior diagnosis of autism. And when they did an autism screening measure, 27% of those folks had it. Or met those criteria. Again, it doesn't mean they were diagnosed with it, they met the criteria. So I think what is really clear in a lot of these studies is there's a wide range of prevalence. There's a wide range of how we might see the overlap of FND with autism. And what should we do about this, right? So first, my message to clinicians is that if we're working with people with autism who are having some movement difficulties, so mobility issues, functional seizures, functional sensory issues, we should be screening for functional neurologic disorder if they're not already diagnosed. Now, this does not mean, the pooled comorbidity was 10%. Not everybody with autism develops FND, and not everybody with FND has autism. That is absolutely true. But should we have it on our radar? Yes. Just like I would say we should have, if we're working with somebody with FND, we should be screening for EDS and for POTS and for MCAS. Those three things, by the way, go hand in hand with autism. So we should be, as clinicians, screening this, whether somebody has autism or whether somebody has FND. We don't want to miss it because we want to address the whole person. And that whole person includes their neurodivergent brain and really understanding what their unique brain and body needs. Just another reason why when it comes to FND and treatment, it really should be like a zoom out look at the whole person and not just treat the FND. I think this study really supports that whole person approach. The other thing I would say is the overlap of these diagnoses, right? So last week we talked about interoception. Interoceptive differences or challenges could be found in both autism and FND. Now, the good news, if we are working on interoception, it would be helping that person no matter what their diagnosis, right? And it would be helping them for lifelong skills no matter what. So it's really beneficial. Attention is another thing that we can find overlapping in those diagnoses. So oftentimes a hyper focus of attention. Now you can kind of imagine, so this is not what this article was talking about, but this is what I imagine in my mind, and I get curious about, like, why might FND occur in autism? One, that interoceptive piece. Two, the attention piece, the hyperfocus and awareness. If, let's say, a person with autism has a physical injury and has heightened focus and awareness of that body part or symptoms with that injury, that could actually go from injury to functional neurologic disorder just from the attentional component. Not that the person is purposefully doing that, but their brain is wired to hyperfocus. It's actually really helpful for a lot of things, but it could be unhelpful after a physical injury and lead to the development of FND. Now, this is a topic for another time, but I think we can actually prevent functional neurologic disorders from developing in some folks where we know and understand how their brain is functioning. We can actually help respond to a physical injury, for example, so that maybe a functional neurologic disorder does not occur. So that's another topic though. So interoception, attention, and then sensory processing. That's the third one. That's a big overlap between autism and functional neurologic disorder. And again, I think in the person with autism, if we can really understand what that unique brain and body need from a sensory standpoint throughout the day, we can help them regulate or have the tools to regulate their nervous system. And that can be really really beneficial. Maybe prevent functional neurologic disorder from developing. But if a functional neurologic disorder has developed, then we can actually address and give them tools that help them in their daily life living with autism as well, when we do things like the sensory profile and we give them tools to get through their day from a sensory standpoint. So those three things are all really important and in part of the overlap. Now, I saw one maybe comment come through, and I welcome your questions and comments. I love hearing from you. I love that you voted for this topic because it's a really important one. And this is the first systematic review. This is what's clear in this systematic review is that we need more research in this area. It didn't give us definitive answers. It really did just confirm that these conditions coexist. Okay, and then Allison is saying, every time I try to reprocess cult or faith-based trauma, I feel a seizure erupting in. What great insight. So this person is sharing something for them that they've noticed as a trigger of a functional seizure. And I know, because I talk to other folks, they don't often know what that trigger is. And so first step is to kind of understand that. And then you can build resources for your brain and body in the moment. Now, there is a subtype of functional neurologic disorder that they have discovered research-wise that is related to trauma. And it doesn't mean that you'll always have functional seizures. I will tell you that because many folks will be able to learn what they need and regulate their nervous system and be able to have traumatic experiences, have stressful experiences, and not also have a functional seizure. So I also just want to give you that hope. There's also a large group of people with functional seizures or functional neurologic disorders that are not related to trauma. And I think that can be one of the myths, is that all functional neurologic disorders are related to trauma. Some are, and that is really important to know. And there are some really good strategy and treatment approaches for that. But there are many that are also not. And we need to discover what are some of the other pieces that are contributing to that. Sensory, autonomic, lifestyle, motor control, physical issues, and so on. So thank you for the comment. Thank you so much for joining me live. Thank you. I'm just going to give you, I'm going to show you the article just one more time. This was the article that we reviewed, comorbidity rates of autism spectrum disorder and functional neurologic disorders, a systematic review and meta-analysis of proportions and qualitative synthesis. Mark Vickers is the first author, and it was just published in 2025. And we got some good information. Yes, these coexist. Possibly that's at a 10% rate, and there's more research to do. So we're going to keep listening. We're going to keep staying curious. We're going to keep learning more. I certainly am very curious about this topic, and I'd love to hear from you. What's your experience? What questions, what comments do you have as well? So thank you so much for joining me today. And I will see you next week in our brand new clinic. I'll have to give you all a tour. Thanks so much for being here, and I will see you again soon.